The screams echoing from Cook County Hospital's operating theater in 1908 were so horrific that nurses began crossing themselves and whispering prayers for the damned soul they were certain dwelt within those walls. But the screams weren't coming from the patients on the operating table. They were coming from the surgeon himself, Dr. Heinrich Volker, a man whose secret would shake the foundations of American medicine and expose one of the most chilling chapters in surgical history. Tonight, we descend into the blood-soaked corridors of Chicago's most notorious hospital to uncover the truth about a physician whose obsession with pure surgical technique led him to commit acts of unthinkable cruelty in the name of medical science. The year was 1908, and Chicago stood as America's industrial heart, a city of steel and smoke, where fortunes were made and lives were expendable. Cook County Hospital served the city's poorest residents, immigrants, laborers, and the destitute who had nowhere else to turn when disease or injury struck. It was here, among society's most vulnerable, that Dr. Heinrich Volker built his reputation as one of the most skilled surgeons in the American Midwest. Dr. Volker had arrived in Chicago 5 years earlier, fleeing what he claimed were political troubles in his native Prussia. Tall and gaunt, with piercing gray eyes and hands that moved with mechanical precision, he possessed an almost supernatural ability to diagnose conditions that baffled other physicians. Hospital administrators welcomed him eagerly, desperate for surgeons willing to work with the city's charity cases. But what they didn't know was that Dr. Volker harbored a philosophical obsession that would transform him from healer into something far more sinister. Volker believed that anesthesia, ether, chloroform, and the other pain-deadening agents that had revolutionized surgery since the 1840s represented a fundamental corruption of surgical practice. In his private journals, discovered decades later in a trunk buried beneath the foundation of the hospital, he wrote, "Pain is the body's most honest language. When we silence pain, we blind ourselves to the patient's true condition. A surgeon who operates on an unconscious patient operates in darkness, guided only by anatomical assumptions rather than physiological reality." This twisted philosophy might have remained merely eccentric if not for Dr. Volker's growing influence within Cook County Hospital's hierarchy. By 1907, he had been appointed head of emergency surgery, giving him unprecedented authority over the hospital's most desperate cases. And it was then that he began implementing what he privately termed his pure surgical protocol, performing operations without any form of anesthesia while convincing his patients and staff that they were receiving the most advanced medical care available. The deception was elaborate and systematic. Dr. Volker would prepare patients for surgery in the standard manner, explaining that they would be given ether or chloroform to eliminate pain during the procedure. But instead of anesthetic agents, he administered carefully measured doses of paralytic compounds, substances that left patients fully conscious and capable of feeling every sensation while rendering them unable to move or speak. His victims were trapped in their own bodies, experiencing every cut, every suture, every manipulation of their internal organs, while appearing to outside observers to be peacefully unconscious. The paralytic drugs prevented them from screaming, thrashing, or giving any external sign of their agony. To hospital staff, it appeared that Dr. Volker's patients tolerated surgery with remarkable calm. Sarah McKenney, a surgical nurse who worked under Dr. Volker for 18 months, later provided testimony to medical investigators that would chill readers for generations. The doctor's patients were always so still during operations, more still than I had ever seen. But sometimes I noticed tears streaming from their closed eyes, or their hands would tremble slightly, despite their apparent unconsciousness. When I mentioned this to Dr. Volker, he explained that these were normal responses to surgical stimulation, and actually indicated that his anesthetic technique was superior to conventional methods. Dr. Volker's surgical outcomes were undeniably impressive by the standards of 1908. His patients survived operations at rates significantly higher than those treated by other surgeons, and his technique was so precise that post-operative complications were remarkably rare. Hospital administrators began touting his results as evidence of Cook County's medical excellence, and medical students from across the region sought opportunities to observe his procedures. But what none of them realized was that Dr. Volker's exceptional results stemmed directly from his patients' conscious awareness during surgery. Unlike unconscious patients who might experience dangerous drops in blood pressure or respiratory depression from anesthetic agents, Volker's victims maintained full physiological function throughout their procedures. Their bodies could respond normally to surgical trauma, allowing him to monitor their condition with unprecedented precision. But the true horror of Dr. Volker's methods extended beyond the physical agony he inflicted. His patients, trapped in conscious paralysis during surgery, were forced to endure not only unbearable pain, but the psychological trauma of complete helplessness. Many emerged from surgery with what we would now recognize as severe post-traumatic stress disorder, describing nightmares of being buried alive or tortured by unseen hands. Margaret O'Brien, a 23-year-old factory worker who underwent appendix surgery under Dr. Volker's care in September 1908, kept a diary during her recovery that provides haunting insight into the aftermath of his procedures. I wake each night feeling hands inside my body, cutting and pulling. The doctor says it's normal to have dreams after surgery, but these aren't dreams. I remember every sensation, every moment of the knife. God help me. I was awake for all of it, but I couldn't move, couldn't scream, couldn't beg him to stop. How is such a thing possible?
Dr. Volker's deception required extraordinary planning and coordination. He maintained detailed records of paralytic dosages needed to render patients immobile while avoiding respiratory failure. He developed techniques for monitoring consciousness levels during surgery, using subtle tests, pinpricks, eyelid manipulation, response to verbal commands to ensure his victims remained aware throughout their procedures. Most diabolically, he created false medical documentation that portrayed his paralytic compounds as revolutionary anesthetic agents. His surgical reports described administering Volker solution, a supposedly advanced German anesthetic that produced superior results to conventional ether or chloroform. He even published papers in medical journals claiming that his techniques represented the future of surgical anesthesia. The truth began to emerge in November 1908 when Thomas Brennan, a hospital orderly, discovered Dr. Volker's private laboratory hidden in the hospital's basement. Brennan had been investigating strange chemical odors emanating from beneath the building when he uncovered a room filled with glass vessels containing various compounds, detailed charts tracking patient responses to different paralytic agents, and, most damning of all, recording equipment that Dr. Volker had been using to document his patients' barely audible attempts to communicate during surgery. Brennan's testimony to hospital investigators painted a picture of a man who had transformed surgical practice into a form of scientific torture. There were charts on the walls showing different types of paralytic compounds and their effects on patient consciousness. He had recordings of sounds patients made during surgery, not screams because they couldn't scream, but tiny gasps and moans that only someone listening very carefully would notice. And there was a journal where he wrote about the purity of surgical communication when patients could feel every aspect of their treatment. When confronted with this evidence, Dr. Volker showed no remorse or acknowledgement that his actions constituted medical abuse. Instead, he defended his methods as representing the pinnacle of surgical science. In his final statement to the hospital's disciplinary board, recorded by a stenographer, he declared, "You condemn me for seeking truth in surgical practice. Every patient I have treated has benefited from my willingness to maintain honest communication with their physiological systems. Your conventional anesthesia blinds surgeons to their patients' actual needs and responses. My methods may cause temporary discomfort, but they ensure optimal surgical outcomes." The investigation revealed that Dr. Volker had performed his paralytic procedures on at least 68 patients over a period of 14 months. His victims ranged in age from 14 to 73 and included men, women, and children from Chicago's most vulnerable populations. Many were immigrants who spoke limited English and trusted that American doctors would provide the best available care. Perhaps most disturbing was the discovery that several other medical professionals had suspected something unusual about Dr. Volker's techniques, but had chosen to remain silent. The exceptional surgical outcomes and apparent compliance with patients to his procedures had created a culture of willful ignorance among staff who benefited professionally from association with his success. Dr. Heinrich Volker was dismissed from Cook County Hospital in December 1908 and disappeared from Chicago shortly thereafter. Hospital administrators, desperate to avoid public scandal that might damage the institution's reputation and funding, chose not to pursue criminal charges. The official record stated simply that Dr. Volker had pursued surgical techniques incompatible with accepted medical standards. But the impact of his crimes extended far beyond his immediate victims. Hospital investigators discovered that several patients who had undergone surgery under Dr. Volker's care had committed suicide in the months following their procedures, unable to cope with the psychological trauma of conscious surgery. Others had developed chronic conditions, severe anxiety, persistent insomnia, and what medical professionals of that era termed surgical melancholia, that suggested lasting mental damage from their experiences. If you're finding this story as disturbing as I am, I'd love to hear your thoughts in the comments below about how such systematic abuse could go undetected for so long. And please subscribe if you want to hear more about the dark chapters in medical history that shaped modern patient protection standards. The Volker case prompted Cook County Hospital to implement some of the first formal protocols for anesthetic administration and surgical oversight in American medical history. These policies required multiple witnesses for anesthetic procedures, detailed documentation of all substances administered to patients, and regular review of surgical outcomes by independent physicians. However, questions remain about whether Dr. Volker's practices were truly unique or representative of broader problems within early 20th century American medicine. Several similar cases emerged in other cities during the following years, suggesting that the use of paralytic compounds to facilitate surgical procedures while avoiding the costs and complications of proper anesthesia may have been more widespread than historical records indicate. The fate of Dr. Heinrich Volker himself remains a mystery. Some reports suggest he fled to South America, where he continued practicing medicine under an assumed name. Others claim he returned to Europe and established a private surgical clinic specializing in procedures for wealthy patients seeking discretion. Most disturbing of all are unconfirmed accounts that he may have found employment with government agencies interested in his expertise with paralytic compounds and conscious surgical techniques. What we do know is that his methods, while representing an extreme example of medical abuse, reflected broader attitudes within the medical profession of that era. Patients were viewed as passive recipients of medical expertise rather than partners in their own care. The concept of informed consent was virtually unknown, and patients from marginalized communities, the poor, immigrants, racial minorities, were particularly vulnerable to exploitation by physicians who viewed them as experimental subjects rather than human beings deserving of compassion and respect.
The psychological impact of Dr. Volker's crimes on his victims cannot be overstated. Medical historians who have studied the case note that many of his patients developed symptoms remarkably similar to those observed in torture survivors. Persistent nightmares, severe anxiety, inability to trust medical professionals, and a profound sense of violation that extended far beyond physical trauma. Margaret O'Brien, the factory worker whose diary provided crucial evidence in the investigation, never fully recovered from her experience under Dr. Volker's care. Her later entries, preserved in the Chicago Medical Historical Society's archives, chronicle a gradual descent into despair. It has been 6 months since the surgery, but I feel the doctor's hands inside me still. I cannot bear to be touched, cannot sleep without seeing his face above me. They say I am healed, but something in me is broken that will never be made whole again. The case of Dr. Heinrich Volker forces us to confront uncomfortable questions about the nature of medical authority and the vulnerability of patients who place their lives in physicians' hands. His victims trusted that their doctor would minimize their suffering while providing necessary medical care. Instead, they received treatment that deliberately maximized their agony for the supposed benefit of surgical science. Today, elaborate safeguards exist to prevent such systematic abuse. Informed consent procedures, ethics committees, regulatory oversight, and legal protections for patients. But Dr. Volker's legacy serves as a reminder that medical progress without moral restraint can quickly become medical horror. The most chilling aspect of his story may be how easily he justified his actions to himself and others. He was not a madman or a sadist in the conventional sense, but rather a highly intelligent, technically skilled physician who had convinced himself that patient suffering was an acceptable price to pay for surgical advancement. His ability to rationalize systematic cruelty as scientific progress demonstrates how professional authority and intellectual arrogance can corrupt even the noblest intentions. As we navigate contemporary debates about medical ethics, patient rights, and the balance between scientific progress and individual dignity, the ghost of Dr. Heinrich Volker haunts every discussion. His victims remind us that behind every medical procedure is a vulnerable human being who deserves not only technical competence, but basic compassion and respect. In the end, Dr. Volker's greatest crime was not the physical pain he inflicted, but his transformation of healing into a form of torture. He perverted medicine's fundamental mission to relieve suffering into a justification for causing it. His story serves as a permanent warning about what can happen when medical professionals lose sight of their most basic obligation: to treat every patient not as a collection of symptoms or a research opportunity, but as a fellow human being deserving of dignity, compassion, and care. The next time you trust your body to a surgeon's care, remember that this trust represents one of humanity's most sacred bonds. Dr. Heinrich Volker broke that bond in ways that echo through medical history still, reminding us that technological advancement without moral restraint is not progress at all, but a descent into darkness that diminishes us all.